Good evening, namaste. So, welcome to yet another session of Ask Me Anything. Okay, these sessions happen every Tuesday at 9 p.m., where I'll talk about a small topic and then open to questions. So, we shall start today. Today is another interesting topic. We're going to discuss about different kinds of massages. Okay, so types of massage in Ayurveda. Okay, so there are different kinds of massages. So we'll go through that. Okay, now. So massage is basically called Abhyanga in Sanskrit. Okay, and if you have to understand that, it is when you say I've gone for an Abhyanga, that means I've gone for a good oil massage. Okay, so according to Ashtanga Hridaya, Abhyangam Acharit Nityam. It is something which you have to do every day. Okay, conditions are there. That means you don't have indigestion, you are not sick, all those things. Otherwise, for a healthy person to maintain health, you have to do Abhyangam every day. Okay. So, what are all the benefits of massage? Okay, it's not properties, benefits of massage. Okay. Abhyangam ajaret nityam sa jarashrama vataha. It jara is age. Vataha, it pacifies vata and pacifies aging. It doesn't mean that it will stop you from aging. It means that it will delay the process of aging. Okay. Then what? Drishti prasada pushtyayu. Your eyes, okay, your eyesight will get better when you apply oil. Okay. There's a point to it. I shall come to that. Drishti prasada pushti promotes strength. Ayu, it promotes your well-being, life. Then what? What does it do? It also, okay, nidra sutvak dadhyakrit. It helps you sleep really well, in the sense, if you go through a proper massage, you'll notice that you will feel sleepy. So this is again a problem when we face as doctors, when we face with patients when they undergo treatment. Some treatments they'll have to undergo massage. So we tell them not to sleep after the treatment especially during the daytime. They find it very difficult. So we tell them, if at all you want to sleep, sit on a comfortable chair and then close your eyes for some time. Don't lie down. Okay. It promotes sleep. Okay. So you can sleep in the night, no problem. Then Sutwak, your skin becomes really good. Dardhya Krit. Okay. And your skin not only becomes good, it also becomes very, very tight. So these are the good effects of massage. Okay, and how do you have to do it? Shirashravana padeshu, so that Shirashravana padeshu visheshena tam shilayet. I've told this multiple times in different occasions. In the sense, you have to apply on the head, the ears, and on the feet. Okay, normally below the knees. Okay, Shirashravana padeshu tam visheshena. Specifically, you have to apply. In the sense, you have to apply all over the body, but you have to give more importance to your head, ears, and feet. So when you start applying oil daily onto your head, that is when it becomes good for your eyes. Not applying on your body, but it should be applied on the head on a regular basis. So people who apply oil on the head on a regular basis and do not wash it off with a shampoo or something like that, what happens is a little bit of oil stays there on the scalp. They use a towel and then they clean it. So, and they apply again on top of it, again on top. It happens every day, right? That oil slowly starts seeping, and they'll always have an oily face sort of thing. What you have noticed is, in such cases, people wrinkling of skin, that's why it said twak dadhikrit. It will make the skin tight. People who apply oil on a regular basis will delay wrinkling of skin. Okay, so head, ears, and feet you have to apply on a regular basis. Now let us come to the different types of massages. As far as the consistency goes, you have got the oily Abhyanga and you have got the dry massage. Okay, the dry massage is basically called Udvartanam. Okay, and it has got a different property. So Udvartanam Kapaharam. It reduces kapha. Medisa Pravalayanam. It helps you remove your fat. Okay, that's why for people who want to lose weight, for obesity, we do Udvartanam massage. Okay, so Udvartanam Kapaharam Medisa Pravalayanam. Sthirikaranam Anganam. It makes your body tight. Tvak prasada karam. It also improves the quality of your skin. Udvartanam. Okay, this is not something which you're not supposed to do on a regular basis. Normal abhyangam you can do on a regular basis, and Udvartanam is a part of treatment. We do it. Okay, then direction wise, Anuloma and Pratiloma. Okay, Anuloma, Loma means hair. Okay, Loma or Roma means hair. So Anuloma means along with the hair. In the sense, you look at your body, you can see the direction of hair growth. So when you do the massage towards the direction of the hair growth, it is called Anuloma. Normally, for wellness or for a healthy person, we always do Anuloma massage. Okay, next one is Pratiloma, that is against the growth of hair. Okay, that is done in specific conditions. Udvartana sometimes, if you want to get good results, very good results, Udvartana sometimes is done against the hair growth. So it's slightly painful. Okay, even for conditions like varicose. Okay, normally if you're doing Anuloma, you'll be going down. But for conditions like varicose, we normally do Pratiloma massage. You want the blood flow getting back into the circulatory system. Okay, and then pressure wise. Okay, pressure wise, when you do normally at home, when you do the massage, you apply oil and do a nice comfortable massage. That is called Samvahanam. Okay, and but if you actually if you want to give it a little bit of pressure, you call it Abhyanga. There's something called Utsadanam. Utsadanam is just application of oil. Samvahanam is a little bit more pressure. There are other pressure things called, okay, Udgharshanam is also. Udgharshanam is basically more done with Udvartana. When you use dry powders, by the word you can make Gharshanam is really friction. Okay, you will do it a lot of friction. What happens when you do that is, you break a lot of fat tissues and cell bodies there, and those are easily absorbed back into the system and expelled. Okay, so these are the types of massages we have got. So if you have got any questions, you can ask. Okay, so I see a few questions starting with him. Okay, would like to know more about Agni Karma. Cons. Okay, yeah, Agni Karma is it is something done for many conditions, especially when you have got warts or cons, or even when you have got nerve compression like sciatica along the nerve. You mark points and then you do Agni Karma is basically heating that place. Okay, you have got a shalaka which is used for Agni Karma. Mostly Pancha Loha is being used. You heat it very hot and then you apply. You burn that area, so you are burning through the line of the sciatic nerve, and you see that instantaneously you get pain relief. Okay, it's an amazing thing. Same thing you can do for corns also, because problem with corn is after you remove is also, if there is something remaining, there is a chance of the corn coming back. So after you remove the corn, we do Agni Karma. You burn that area so that recurrence of corn does not happen. Okay, yeah, Kavita, good evening. Whenever I sit under fan, I get cold and headaches. Is there any alternative for this? Yes, I would say don't sit under the fan. Okay. What you have to note is why, after doing what, when you sit under the fan, you get a cold. Okay. Probably it might be after a shower or something like that. Or probably you might be allergic to that kind of wind. So there is definitely a lot of phlegm inside your head that is getting triggered because of the cold wind. So in my opinion, you have to do a little bit of nasya and try to remove all the phlegm that is getting triggered because of the wind. Okay. If fan is problematic even while sleeping, I recommend that you tie a towel, cover your ears and go to bed. You will see a lot of difference. Could you go over the contradictions again for when it's not good to do? See, especially Kim, if you have got ajirna, okay, ajirno kaphagrasta, that means you have got kapha diseases. Basically, two conditions. Okay, one, when you have got ajirna, that means you have got too much of ama. So conditions like cold, it's all kapha, too much of kapha there. You have got jwara. Lot of conditions come under this thing. Okay, so wherever you have got too much of kapha or you have got indigestion, okay, and things, I would say it's always good for you to basically avoid doing massage. But otherwise, for a healthy person, you can do it on a daily basis. Can you please give some good snack options instead of biscuit and breads? I recommend no snacking. Hello world, absolutely no snacking. If you don't have a medical condition, like if you're diabetic and you want to eat something, then it's a different thing. Otherwise, snacking is not a good option. You have, ideally speaking, our forefathers used to eat only twice daily. Now, because our nature of work and all those things, we eat thrice. Okay, so you can have your breakfast, you can have your lunch, and you can have your dinner. Don't try to eat anything in between. No snacks at all. I would say no snacks. So there is nothing called a healthy snack. Snacking is always snacking. Okay. It is okay. Is it okay to go back and forth motion on the limbs while doing Abhyanga? I do circular motions over the joints and back and forth motions over the limbs. Yeah, see, Kim, when you are doing massage on a regular basis and you are doing it for yourself normally, nobody applies it like you do it like this only, because you are actually not applying a lot of pressure. You can do back and forth. But if you are applying pressure, then you should know very clearly where you're applying pressure and why you are applying pressure for. Then this anuloma and pratiloma actually matters. Okay, otherwise doing back and forth is fine, and doing in circular motions around the knees is also fine. That's not a problem. But sometimes when we come across knees which have got knots there, doing circular might not be enough. Then we do the thing, the anuloma thing, where we try to break the knots. It might be slightly painful, but in those conditions, we normally prefer to doing it anuloma. Otherwise, for general massage, if you're doing for yourself or just doing for somebody else, you can do it back and forth. But otherwise, how would I say, medicated massage, it should be one direction normally. What kind of massage, which oils are recommended for lymphoedema, lower leg below knee swelling? Okay, it depends, first of all, whether your lymphoedema, whether it is inflamed or you have got pain or it's more about swelling. Three conditions can come in lymphoedema. Okay, so if there is inflammation, we would say you cannot do massage at all. Okay, then there is something called kashaya dhara, where we keep on pouring medicated kashaya decoctions to actually get that inflammation out. We also give internal medicines to remove that inflammation. Without removing inflammation, absolutely you cannot do any massage at all. Okay, that is point number one. Because if there is inflammation, you apply massage, the pain or the condition worsens. So you should know, it's not like the person has got pain, he's got swelling, you can do massage. No, you should know, in our language, you should know whether there is ama or not. Okay, there is something, toxins or some accumulation there. If you apply oil there, it can go up. So you have to first dry it up, you have to remove the inflammation, and then go for massages. Okay, Srinivas. Yeah, Hemway, it is 100% safe. Nothing to worry at all. Okay, they're not going to burn your whole body, right? It is just a spot. Okay, and it is 100% safe. They'll remove the corn, and then inside from where they have removed the corn, they'll just burn it. So that whole area is cauterized, we call it. Once cauterization happens, the skin fails to grow back. Okay, and then after Agni Karma, The paschat karma, what you follow after that, is also important. When you're going to the doctor who does the Agni karma, he will explain it to you clearly what to do. Follow instructions. It is very safe. Okay. Why drinking too much water can cause diarrhea? Okay. The one, okay, Kim, it is not that everybody will get diarrhea because they're drinking too much water. Okay. It is a lot of combined factors, especially if you are into a lot of foods which are not compatible. Okay. Plus, you have also consumed a lot of water. So it's all combinations. What happens in such conditions is the body is trying to eliminate whatever you have consumed. Okay. And when it is eliminating, and at that point of time, when you are somebody who is consuming a lot of water, there the body immediately starts off with diarrhea. You have got, so drinking too much of water is one reason which can lead to diarrhea. Okay, atisara, that means excessive flowing of thing. And uh, if atisara or diarrhea, chronic diarrhea, is not managed really well, that is the one that will lead to grahani roga. Okay, grahani roga can be somewhere compared to IBS. So if you have not, see, IBS doesn't start overnight. Mostly you would have noticed that most people whom you talk to, people who have got IBS, you would have noticed that they had a bout of diarrhea somehow, somewhere. Might be wrong foods or something, or a lot of medicines or antibiotics, something, their stomach upset and they had huge diarrhea, and that was not properly managed. Or you thought that the diarrhea is okay and you started eating foods which the body could not handle, then you end up in IBS, okay, or Grahani Roga. So directly, if you just drink, just because you drink a lot of water, you might not get diarrhea. There's another thing also. People who drink too much of water also have got a tendency of getting diabetes. Because atimutra is one of the lakshanas of prameha. Okay. So prabhuta avila mutra. Prabhuta mutra is excessive urination. So if you are somebody who drinks a lot of water and then you pass a lot of urine, then you are actually setting in the premonitory symptom of prameha, that is excessive urination. So drinking water can lead to so many things over a period of time. What is the ideal way to do Abhyangam when there is prolonged pain in the body, muscular and nervous pain in different parts of the body? Yeah, Janani, Abhyangam, when you have got pain and especially muscular and nervous, it is always good to follow the Anuloma method, okay, with moderate pressure. Okay, don't use too much of pressure trying to release the muscular pain, because any issue, don't ever try to solve the issue in one sitting. That's the reason why we always say, you have to do it for 3 days or 5 days, because the day he comes, we apply oil and do a little bit of, we know that there are knots there, and breaking those knots, you break it on the first day, he'll probably get a fever. Okay, it will be so painful, so what we do is we slowly do it. It might take 3 days, 5 days sometimes to break the knots and get the inflammation out of the muscle. So don't be in a hurry, but Abhyangam should be done Anuloma. It's your choice. There's nothing called Papa or Punya here. Okay, as long as you don't hurt somebody, you don't hurt yourself in the process, you don't feel guilty, okay, about a lot of things, everything is fine in this world. Okay, you understand that you are not causing pain to anybody. That's very, very important. Okay, in the sense, is drinking alcohol okay? You can ask me that question. But if your drinking alcohol is creating pain to somebody else, might be your wife or somebody else, then it is not a good thing. Okay, but you're sitting in the evenings having one drink and nobody bothers. You're not. See, it is not. It is Papa or Punya is what guilt you carry in your mind. If you're not hurting anybody in the process, okay. I said sense in the sense, your parents, the partner, anybody. If you're not hurting anybody, Go ahead. When I wake up in the morning, I notice that my nose is plucked. Around 5 minutes of getting down from bed, I will find. See, when you are when you're sleeping, when you're lying down in that position, okay, and you are dead, sleeping close to death, okay, that is the most important property of kapha, the sthira guna, not moving. Okay, so the moment you get up, you have come to this position, and the kapha starts melting down and you start moving. Okay, you, so from this sthira you have introduced chala property, that means movement property into your day. Okay, that decreases kapha and then it opens up. So it's very simple theory is from sthira you have come to chala. Okay. If you want to perform Virechana Nasya, I would say it's always good to go to a doctor and get it done with his supervision rather than doing it at home. Okay, you can't do a Virechana Nasya at home and feel safe about it. Okay, that's just my advice. Okay, small daily doing Nasya, 1 or 2 drops, 3 drops, and a Pratimasha Nasya is fine. If you are intending to do a Virechana Nasya, it is always good for you to prepare yourself in the sense you have to do the Sneha, Sweda, and then the Panchakarma, then the removing it, and then the Paschat Karma. So it is a process. Don't do it at home. Go to a doctor. Okay. Does face need different oil or saves? No. Okay. Janani, face, generally speaking, I'm speaking generally. If you've got an issue, that's a different thing. Generally, for a healthy person, you can use the same oil for the face and the body. Hair, it depends, because many people are used to applying oil, with a coconut base. Then I think hair oil can be different. But otherwise, for the face and the body, you can use the same oil. Okay. How to identify the kind of swelling inflammation in the body too? See, generally this comes out of experience, because we see a lot of patients, we know whether you have got pitting edema, whether inflammation is there, sometimes you get pitting edema, then we see that there's a lot of kapha. Sometimes it's painful. Sometimes you touch, you see a lot of heat. Sometimes you see reddish mark over there. Sometimes you see blackish mark over there. All those things actually imply, can you hear me? It is raining really hard outside. Can you hear me? Okay, so all these things imply to different conditions. So the way we manage it is also changes. I think it's not something which I can just tell you in a 2-minute casual conversation. This is a theory in depth, where probably if you are an Ayurvedic doctor or somebody, yes, you go to a doctor who's practicing for quite some time. He will be able to tell you what kind of swelling it is and how to handle it. Okay. But one thing I'm telling you is, if you have got inflammation, it is not very safe for you to do oil application. You have to get that inflammation out before you do the massage. Otherwise, you can end up in problems. Then you'll blame the massage. Oil was not good or that was not good. It was just thing is that it was not the right condition for you to do the massage. To know it's just ama, just blood clot kind of inflammation. See, blood clot and all those things, we don't consider that too much as ama. Okay, and it is once blood clot, if left on its own, okay, it gets reabsorbed into the system. You don't even have to worry about it. But if you have got a hit and if it is deep down, okay, then there are different ways in which you have to remove it. Even application of bleach is one way to actually remove it. We have got different methods in which we handle it. But if it is ama, okay, the most important thing about ama is gurutva. That means feeling of heaviness. Okay, probably that limb or the whole body also might feel heavy because in the presence of ama. So handling that not only by external treatments, also by giving something internally to burn that ama is very, very important, Janani. Okay, this is theoretical part. Okay, and without properly removing the ama, if you do treatment for the joint or for the swelling, you will not see long-term decision. Temporary patchwork and all you can do. If you want to see long-term, you have to first remove the ama. We call that ama pachana. and then you have to do the treatments. It's my pleasure, Hem. Okay. How to clean ears safely according to Ayurveda. Ayurveda say, I've told you very clearly the beginning of this session itself. Shirashravana padeshu tam visheshena shilayet. You have to apply the oil in the head and in the ears. One drop in the ears also. So every day you apply one drop of oil in the ear. What will happen to your ear wax and all those things? It actually comes out pretty fast. You don't have something very dry. You get very dry things and all when you have got a problem with your lifestyle. Hello world. Okay, I don't know your name. Okay, so you have, so once it is always moistened with oil, it is very easy for you to remove it. You can just, in olden days there is something called a chevitundi in Malayalam, we call that, where it's available in the market even in India, where you can just put it and take the wax out of the ears. Okay. Sai Nivas, I would say lymphoedema is always good. Why don't you go to a doctor? Okay. I don't know what your condition is, and without knowing your conditions, the other part of your things, how your sleep is, how your digestion is, lot of other factors, Ashtasthana Dashaveda Pariksha. Without doing this, I just gave you an overview as to how we manage this. So I don't know where you are from, Srinivas. If you can go to a good doctor close by where you stay, he will actually help you out. And he might also tell you how to do it at home probably. He'll tell you boil, probably he might give you some powder. It could be Jadamayadi Churnam, it could be Cotton Chukadi, whatever it is, he'll tell you boil it in this much of water, cool it, and then pour it over that place for about 10-14 days. Or apply this powder on top of this till the inflammation goes down, and then start doing other steps. Okay. Please go to a doctor. Okay. Thank you, Jenny. The rain also stopped suddenly. Well, she said, what is your opinion on sunscreen? Is suntan fine or to be avoided? See, sunscreen is something which you are, you're blocking the sun from hitting your skin. Okay. Ayurveda does not, first of all, sunscreen, you have to apply sunscreen only when you go out when it is extremely hot. Okay. And that too in the summers. So Ayurveda says, okay, Namaste. Vyayamas arkas tejet. Avoid hot sun during the summers. So I don't think there is any reason why you should be stepping out at 11 o'clock, between 11 o'clock and 4 o'clock, or maybe 10 o'clock and 4 o'clock to get exposed to that hot sun. Okay, if at all you want to go out, I say fine, okay, you can apply something, or I would say wear something which covers your body completely rather than applying any chemical on your body. As much as possible, stop getting exposed to that kind of hot sun. Early morning and late evening is actually good, okay, and that will actually tan your body a little bit, and tanning is actually good, okay, especially for brown skin people, or black skin people. They don't have too much of problem with excessive sun. Problem is only for people who have got very light skin. Okay, they have got a problem that they might get ulcers or even skin cancer. So for them, yes, they can get that. So sunscreen is fine. But normally for people like us, Asians, brown skin people, I don't think you have to resort to too much of suntan. Sunscreen lotions. Okay. So any more questions, or shall we come to an end? Today's session. It's only 30 minutes. Oh, wow. Okay, then. Okay, so I'll see you next week with another session. Okay, so till then, bye-bye and good night.